Grand Senior System Director for Infection Prevention at Hartford Healthcare. Um, Here to do the weekly briefing as we, pivot through or try to pivot through this pandemic process. We've been doing this for a good while, just giving an update as to what the system Hartford Healthcare is doing, collaborating with the community as we battle through this process. Also, we'll have an opportunity to speak to some experts from pharmacy, virology, just to discuss some documents that came out recently from the FDA as well. So, at this time, one of the things that we're going to focus on some key questions that we've gotten over the last 24 to 48 hours. As you've seen, state numbers have gone up, I want to say exponentially, or one-day testing prevalence has increased quite significantly. 7-day average, again, also has increased. And this is consistent with what we've spoken about prior to the Thanksgiving holiday and what we expected to see. With that being said, this is also consistent to times before when the mortality rate also shifted up as well. So, we're still able to manage very well these patients. So I think, obviously we've shifted. If you're seeing how many of these or patients that we're seeing, how many are needing critical care and or overall mortality rate, we're still in a better position than we were before. But this is still very concerning for the community, very concerning for our healthcare providers, very concerning for our healthcare system. Had a discussion this morning with other healthcare groups, and this is something that they're also very concerned about. So, as always, my message to the community is to ensure that we're looking at these numbers. There's many times we come on and we ask that, we look at key data points. A few things we're going to talk about today, I really do ask is, we really pay key attention to it. One of it is the prevalence and how it's ticking up, and also how much it's related to what we believe is coming together in Thanksgiving and social events that might lead to this increase. The other thing is the documents that are coming out now from the FDA. There's a lot of people that we've had communications with, and if you look at the national data about how many people expect to get the vaccine or expect to take the vaccine, I will ask that whenever we make that decision, we make sure it's an informed decision. Whenever we decide not to take the vaccine, or we decide to take the vaccine, it's an informed decision. And there's now more data coming out, and we're going to try to summarize that document and make it available on the Hartford Healthcare site. Efficacy, again, another set of conversations we've been having is about the efficacy of the vaccine. The studies are still very consistent. Nothing's really changed with the studies. It's over 95% for the most part. So that's a big deal. If you look at the average efficacy for flu vaccines that we've had, for decades now, low average for flu vaccines about 40 to 45, sometimes 50%. So 95% efficacy in general for vaccination for the two primary vaccines that we have, the Moderna and Pfizer vaccines, are pretty good, very, very good. The other question that we've been getting is, what's the expected time frame for us to have hands-on vaccine and to actually start the process? So as it stands right now, there's a lot of collaborative efforts that state and local government, obviously the federal government, Hartford Healthcare, and other health systems, to get the vaccine to our vulnerable population, to our healthcare providers who are front-facing in our critical care units, in our ED, and obviously to our communities as well. So there's a lot of effort. Obviously, so the planned FDA meeting and EUA, we're expecting to be within the next few days. In fact, the 10th of this month is going to be a huge month for us. So as soon as that comes out, we'll have more of an idea, but we do expect by the end of this week to have some definitive answer, or if not, definitively have the vaccine in hand and ready to have more of that discussion with the general community. The last thing that I will go over is probably stemming from the first thing that I went over, is the key things and key takeaway from anything that we all will say this morning is the fact that, one, we're getting the vaccine is very close to being here, but the things that we've done over the last few months in order to give us any semblance of actual chance to fight this virus is our social distancing or physical distancing, proper hand hygiene, ensuring that we're wearing our PPE when necessary. And I think for me, one of the most important things, two most important things is if you have symptoms, stay away from family, stay away from loved ones, stay away from work and isolate as quickly as possible. And the next thing is appreciate the fact that a lot of effort has gone into place to ensure that there's appropriate and sufficient testing for anyone, and we should ensure that we're using that as much as possible. So I will pass on to Eric, who is our pharmacy guru. She's going to talk much more about the vaccine. And then after which, at some point, we'll have a Q&A and we'll open the lines for questions and answers. All right, Eric.
Good morning, everybody. My name is Eric Arlia. I'm the Senior Director of System Pharmacy for Hartford Healthcare, and I wanted to just take a couple minutes to talk a little bit about what we can expect over the next few days. We're all very excited with the updates this week, with more data being released about the vaccine. Our clinical leaders are going through it. Dr. Patrick Troy, who I'm going to introduce when I'm done, is going to show you a little bit of some of the information that was released yesterday. As Keith mentioned, it's all very positive, and we do expect that the emergency authorization of the Pfizer vaccine is imminent after Thursday's hearing. So here at Hartford Healthcare, we'll be prepared and ready to receive the vaccine as early as Friday. That would probably be the first day that it would be approved for emergency use. The CDC has told us that they will ship the vaccine within 24 hours of approval for emergency use authorization. So we have teams ready. Even if it comes over the weekend, we'll be prepared to receive it. Here at Hartford Hospital, our first allocation we will receive here at Hartford Hospital, but we will be supporting clinics to vaccinate healthcare providers within our system at all of our acute care facilities. And as I've mentioned before, the Pfizer vaccine is the one that's ultra frozen, and we have the capacity to store that here. It's good for 5 days in the refrigerator. So as our healthcare providers begin to sign up for our clinics, we will defrost the appropriate amount of vaccine and position it in place to be able to vaccinate our healthcare providers. The allocation of the vaccine is really being split in the early weeks between health systems and nursing homes. There's obviously a great desire to vaccinate our most vulnerable patients, as well as our healthcare providers who we need to continue to care for us through the pandemic. So for these first few weeks, we'll be focused on managing our side of the equation, which is really our healthcare providers. And we'll be focusing mostly on our healthcare providers in the first 2 to 3 weeks that have the highest risk of exposure, ones that treat COVID patients or work on units that treat COVID patients. So that work is all underway within our system. One other really exciting thing that came out this week was that Governor Lamont signed an executive order authorizing pharmacists to vaccinate for the COVID vaccine. Pharmacists have traditionally been vaccinators. Many of you are familiar with pharmacists and retail pharmacies providing vaccines. So this is really just an extension of our vaccine capacity, and I think that's going to be really important as we move through this pandemic. As everybody knows, there's a shortage of healthcare providers as our censuses increase and our COVID population increases. So having the ability to have pharmacists assist our nursing colleagues to vaccinate our staff, and then as time goes by, the community, I think is going to be a huge advantage. And our team of pharmacists at Hartford Healthcare is very excited and enthusiastic about participating in the effort. More than 50 of our pharmacists have signed up and volunteered to be part of the vaccination process. So we're really hoping to reduce the burden on nursing so that they can continue to care for our patients. So it's very exciting. The next 5 to 7 days in pharmacy, receiving the vaccine and getting it ready for the clinics is something we've been looking forward to for a long time. So we're excited that we've finally reached this place. So right now, let me pass it over to Dr. Patrick Troy. He's the Division Director of our Pulmonary and Sleep Medicine Clinic here at Hartford Hospital, and he's been going through some of the data released by the FDA over the last couple of days, and he's going to share some exciting information with you.
Hi, everyone. Patrick Troy. I'm the Division Director of Pulmonary Critical Care and Sleep Medicine for Hartford Hospital. So Keith Grant and I have spent the last day very excitedly reviewing the FDA. So the Food and Drug Administration came out and they basically independent, and I want to accentuate this point, independently reviewed all the data from Pfizer's presentation on their potential vaccine. So this is something that was done by senior scientists. These are career folks who, this is their job. This is what they do for a living. They review this kind of data and they independently assessed, it basically is in a 53-page document, what the vaccine looks like in terms of who was vaccinated, and two big categories of data. One is they looked at safety, and the other one is efficacy, or does it work? Right, so in terms of the second point first, I think as Keith kind of indicated, the efficacy or effectiveness of the vaccine is striking, right? So it's striking across basically every group you could imagine. So independent of age, gender, or race, there is a striking effectiveness in the vaccine, roughly 95%. And with regards to severe infection, it's about 100%. So when the initial data came out from Pfizer a couple of weeks ago that suggested that that's what Pfizer was seeing, the FDA independently reviewed that data and has drawn the same conclusion. So that's from our perspective, from my perspective, from my group's perspective, that's extremely exciting news because it has a chance to sort of really alter the curve on this in terms of changing where the COVID pandemic is moving to. And I think fundamentally what I would tell you is that for perhaps the first time, we actually have an opportunity to take control. We have the ability to make a decision about what we can actively do beyond mask wearing, hand washing, and social distancing. All of those things are important. But this is something that we can literally make a decision to do that is the right thing for ourselves, the right thing for our families, for our neighbors, our coworkers, and our classmates. And quite frankly, the more of us that do this, the more effective it's going to be and the more rapidly it's going to happen. And what I want to accentuate on that point is the graph behind me. I'm going to sort of move to the side. So this isn't my graph. This isn't Pfizer's graph. This is a graph from the Food and Drug Administration's briefing document. So this is the 53-page document that I was telling you about that Keith and I spent the night pouring through. So you don't need to do what I do for a living or to be an epidemiologist. Take a look at this graph. And what you're going to see basically is in red are people who did not get the vaccine. So they got the placebo. And over here is the number of infections on what we call the y-axis. So these are the number of infections. In blue are the number of people who got the vaccine. So starting at day 0 is when the trial starts, okay? Everyone either gets a placebo or you get the vaccine. So for the first 7 days, nothing really happens. And then look at day 14. At day 14, there is a sudden break in the data in between those individuals who are vaccinated, right, meaning that there's almost no infection in that group, and those individuals who get the placebo. There's a very clear separation. And what's happening here, what this means, right, at a practical level from our perspective, is that even 14 days after the first vaccine, there is initial immune response. What does that mean, practically speaking? Protection. Protection from the virus itself 14 days after the first vaccine. And as you can see, as time goes on, right, that separation only increases, meaning that when you get the second vaccine at 21 days, there's even more of a response, more complete protection. So I don't mean to sort of present this to you and say, great news, you only need 1 dose of the vaccine. Absolutely not. That's not what I'm saying. That's not what Keith is saying. But what we are saying is that early on, it's even better than we had hoped for, meaning that when we talk about the 95% protection, yes, that's true. That comes after 2 doses of the vaccine, 7 to 14 days after the second dose of the vaccine. But even in the beginning, a mere 14 days after the first dose of the vaccine, there is some indication that actually protection is beginning to start with the vaccine. The early numbers look like around 50% effectiveness of the vaccine in terms of protection from getting COVID. So that's, if we're looking for a way to not just push the curve down, but to crush the curve on COVID, to rapidly decelerate COVID in our community, this graph is all you need to see to understand how that process would happen, right? So it's not like something that we have to wait months and months to accomplish. This is something that the more people that get vaccinated, even after the first dose, we have more and more protection for them, for their friends, for their families, for their neighbors, their coworkers, their classmates. So that's the first part about the effectiveness of the vaccine. The second part, which is critically important and probably generates as many, if not more questions, has to do with the safety profile, right? So the safety profile is about what we've been saying, right? And it's important to kind of parse out that data because the FDA talks about mild, moderate, and severe of side effects. In general, what I would say is that when you get this vaccine, there's a reasonable chance, sort of in the 5 to 10% range, for the following symptoms. Pain at the site of injection, okay? Muscle aches, fatigue, and a lower incidence, less than 5% of fever. It looks like after you get the second dose of the vaccine, those numbers go up a little bit. However, most of these side effects are in the mild category, right? So they're not debilitating, they're not sort of knocking you out. You may feel it. It looks like young people seem to have a little more side effects than older folks, but we should be aware of it. We should go into it with our eyes open. I want to say, though, that the reason that you're having that muscle ache, a little bit of fatigue, maybe a little bit of chills, has everything to do with the fact that that's your immune system waking up and recognizing this spike protein that I've been talking about now for a couple of weeks and generating the immune response. So it's a positive thing. It's very brief. It's very self-limited, only a day or so, if that even. And I think that if you look at that downside, right, versus the potential upside, both in the short term and certainly what we know at 28 days and beyond, that's a small price to pay for the protection that you get. And again, it's not just about you, right, making this choice. It's about you doing the right thing for each other, for your neighbors, your family, your coworkers, your classmates. That's where the decision needs to be made and thought about closely. So I will wrap up there, and I think we're going to questions. Or back to Keith, I'm sorry, back to Keith.
All right, so I think some super exciting news for everyone. So I think for the Q&A, I think one question Tina just asked, I think came over on the chat it's what's the...
Yeah, it says, can you still get infected with the virus while wearing the mask?
Okay. So there's a few studies that are out there. I think generally, when we talk about this is the entire prism of things to include not just the mask itself, but if it's just the mask, I think probably the best study I've seen is from the University of California, and it says 65% protection from just wearing the mask itself. And again, this is looking at the fact that not all masks are created equal. Not everyone has, full capability of wearing a securely fit mask per se. But in general, if you wear a mask that is compliant to, appropriate fitness and is with good compliance, then your risk should be mitigated quite exponentially. I think way above 65%. But that's the best study out there, and it's a very general study. All right. Any other questions? We'll open up the line at this point in time.
Sure. This is Benny Rob from the AP. For Eric, once we get done with the nursing home patients and the healthcare workers, how does it work after that? Do you notify heart patients, diabetes patients? How do people line up for this vaccine after we're done with this first, with the initial process?
Sure. So when we get to vaccinating the public, I expect, and actually Keith is a member of the committee here in the state, that will be deciding on the stratification of the general public. But it's our expectation that people with pre-existing conditions that are known to cause more severe COVID infections would be the first members of the general public that would be vaccinated. So, you know, our system and others will do our part to try to help identify those patients and get them connected with the vaccine as quickly as possible.
And then one might be a dumb question, but is this vaccine going to be like the flu vaccine where you need it every year, or like the polio vaccine where you get the 2 doses and you're done for life?
At this point, that's not known because it's such a new vaccine, and it's a new type of vaccine also. First 2 messenger RNA vaccines that have been developed. We don't really have a clear picture yet on how long the immunity lasts. So the Pfizer study and the Moderna and other studies are going to continue to follow the patients that were in their study, and as time goes by, I think we'll get more of a picture on the duration of the effectiveness of the vaccine.
Thank you.
Eric, there's a question about the
Hi, everybody. It's Matt Karen from Fox 61. When we're talking about vaccine safety, as you know, the UK has already started vaccinating, and I guess their regulatory agency has advised people with a history of allergic reactions not to take the Pfizer shot. It also says it needs to be administered only where resuscitation is available. So just wanted to get your thoughts on that and what that may mean.
Yeah, so we've seen those reports here in our system, and we're reviewing them now. It's very, very fresh information. I don't really want to comment on what our official response will be. It's something that definitely we'll be taking a look at more further. I don't know if Dr. Troy, if you have any other comments on that.
I agree with you.
Yeah, more to come on that.
Well, but I mean, it's not necessarily uncommon, I guess is what I'm getting at, for there to be a allergic reaction to a vaccine necessarily, right? I mean, can you just comment a little bit about what you know?
Sure. I mean, allergic reactions to vaccines do occur, you know, there's a vaccine reporting system that we'll all be using, and there's actually been a couple of additional ones that have been designed specifically for the COVID vaccine. I think the most important part of that is that patients who receive the vaccine understand what to look for, and that we report those side effects in so that they can be evaluated by the FDA and other bodies.
Yeah. So,
All right, and one more. The vaccine is obviously going to be good at preventing people from getting the disease, but can you talk about how it might not prevent people from spreading it?
Yeah, you want to take that, Dr. Troy?
So, hi, it's Patrick Troy again. So I can take a stab at that one. So if we think about the way that the vaccine works, right, essentially we're giving our body a sneak peek at this spike protein, just a spike protein, just that part of the virus, not the virus itself, and we're allowing our body to generate an immune response to that spike protein, which is the business end of the COVID virus, right? It's the way it gets into our cells. So that part of the immune system is laying in wait. I've used the analogy of it's the sort of the National Guard waiting to respond to the virus when it comes in. So in theory, what we know is that if the immune system can be ready and waiting to respond to when the COVID virus actually enters the body and shows off this spike protein, we have reason to believe that you will not get infected with a 95% effectiveness. We have reason to believe from what both we have seen and what the FDA is reporting in their analysis, it's 100% effective in terms of preventing severe infection. That's hospitalized COVID. That's the kind of COVID that I spend my days treating. But it makes sense in theory, and I'm speaking in theory here, that if you're preventing replication of the virus, preventing it from building up in your cells, right, which is what it wants to do, we know that infection spreads based on a couple of what we call the density or the intensity of your contact, which has to do with how much virus does that individual have in them, and basically how close were you to them, how long were you next to them, and in addition, were you wearing masks, hand hygiene, and all of those things. So we have reason to believe, it just in brief, that if we can prevent the virus from getting into the cells and preventing infection, there is a very reasonable chance that you would expect to see decreased transmission along with that, although these specific studies have not answered that question in particular. Keith, do you have anything to add to that?
that's exactly correct.
Keith concurs.
Thanks.
Yep.
All right. Any other question? Tina?
Mary Ellen Godin, she's a reporter, she's on the line, but she's asking through Facebook, can you address the allergic reactions in the UK?
Yeah, so that's exactly what we just spoke about. And I think the UK study, just looking at the study so far, and Eric's right, it's very new data. In fact, this morning, Eric's the one who brought it to our attention for us to take a good look at it, and we'll, as soon as this is concluded, we'll go over that. So the next time we get together is something that we'll talk about. But I think preliminarily, there's a few of these patients are patients with history of allergic reaction. So that's something we want to look at going forward. But
another question, what about the fact that the vaccines have been only studied for weeks? How can we know for sure they are safe?
I think one of the things that we've gotten a lot of questions about, and Dr. Troy can answer this as well, is the fact that this is a vaccine that was rushed, and that's really not the case. So when you look at the actual technology itself, this technology was developed years ago. I think, in fact, the first time this technology was materialized to be used, I think, in 2004. So technology, the mRNA technology, has been around for a while. So basically what we've done is we've had the opportunity to send a separate message. So we're sending a message within this technology, and that message now is look out for COVID-19 or SARS-CoV-2, this specific spike protein, and develop immunity or antibodies to it. So it's not an old technology, it's not a new technology per se, and that's one of the things we really want to focus on. Now, in regards to the actual study itself, that's right. One of the things we don't have on our side where science is concerned, and for us, something we wish we had, is time. And in many ways, so time we're in within this study, and time we're in, if you look at the amount of people that are getting infected daily, and the amount of people are dying from this vaccine, we really don't have, much time to, I hate to use the term proverbially, but play with, so to speak. So I do agree. I wish we had more time and we could study this for probably 5 or 4 more years, or 4 or 5 more years. But at this point in time, based on the studies that we've seen, this is probably, the technology is older technology. I shouldn't say older technology. It's not a new technology. And the studies that we've seen and data that's coming out from Pfizer and the summary from the FDA is very, very promising.
Another question, is the vaccine made from eggs?
No, it's not.
Is it safe to have the vaccine if you have high cholesterol and type 2 diabetes?
Yes. Based on what we've known so far, yes, that's correct.
Is this safe for lupus patients with organ transplant?
I don't know entirely how to answer that at this point, and if you have anything lights to shed on that, do you?
I can a little bit, yeah. Okay. So we don't know with exact specificity saying, I have lupus, I have an organ transplant. That's a sort of narrow group of folks. But what we do know is that high-risk groups of individuals were specifically identified with intentionality in these study designs. And what I mean by that is, I've said this before, COVID is not like flu. Flu is an equal offender, everybody gets the flu and everyone feels about the same. COVID is not like that. COVID targets specific populations for worse outcomes, and those specific populations include those of the folks who are older, and specifically younger folks who have comorbids, what we call comorbids. What does that mean? Diabetes, high blood pressure, high cholesterol. We wanted to make sure, right, and the FDA insisted that both Pfizer and Moderna specifically enroll these groups of folks to look and see whether they had an equally good response, and the answer is that they did. With regards to the organ transplant question, we simply don't know that answer yet.
If you had the virus and your antibodies are high, should you still have the vaccine?
That is an outstanding question. So that is a great question. The answer to that is absolutely yes. Why? Okay, so why? So the why is that if we look at the data, right, in the early phases of these trials, what were they looking at? Well, they were looking at whether the vaccine itself could really generate an antibody response at all. And so it did, but then the question is, well, like, okay, but compared to what? And so the compared to what was exactly what you just asked. People who had the virus, and they compared the level of antibody response they had. So these are people who didn't get vaccinated but just had been exposed to the virus, compared to people who didn't have the virus but got the vaccine. And what they found, not universally, but in many cases, was that specifically with the Pfizer and Moderna vaccine, there was at least a good response in terms of the immune system, and in many cases, a far more robust response of the immune system. And so when you think about it, this is yet another chance, if you've had the virus, right, maybe asymptomatically, or maybe just a mild case, this is another chance to boost your immune system. We do know that those individuals who have more mild infection tend to have a more mild immune response. So this is a great chance for those folks to boost their response. For folks who didn't know it, to boost their response as well. So absolutely, if you've had the infection before, you should absolutely get the vaccine to boost your immune system, to give it some more memory and some more power. Keith.
I have another question, if that's okay.
Yeah, absolutely.
So how are we going to make sure that, because obviously a vaccinator, someone who's delivering the vaccine, is going to be having a lot of interactions with members of the public who they're giving the vaccine to. So will they be tested regularly, perhaps daily, to make sure that someone who's delivering this vaccine does not have coronavirus themselves and isn't exposing the people who they're delivering the vaccine to?
Good. So that's a very good question, and I think that's a good opportunity for us to identify our colleagues on the front line that's doing this every single day. They're seeing patients who are positive. They're caring for patients who are positive, or families, or friends, or neighbors within the community. So everyone, every nurse, every doctor, every custodial colleague, every security guard, every single person that works in healthcare in our community, this is the opportunity to just identify how much at risk they are and how much this is going to be very important. So yeah, with the appropriate PPE, we've been doing this for the last few months. We care for over 300. We're caring for over 300 patients within our healthcare system at this point in time, and we're doing so very, very safely. So with the administration and distribution of the vaccine, that's going to be the same exact cadence with the application of the appropriate PPE. Testing is available. It's obviously, Hartford Healthcare has done a significant amount of work to ensure that we're testing appropriately, and testing is continuously available. We're doing about 35,000 tests per week at this point in time. So that's available, and if we see something that we need to put some more focus on, there's expedited and more specific testing that's done. So very, very good question. It's a good opportunity for us to recognize our folks on the front line. Any more questions before we close out?
Yes, I have one from the AP. Just, do you anticipate which vaccine you will get, and can you talk about whether when you get the first dose of one vaccine, you stick with that particular brand of vaccine, or are they interchangeable?
Good question. They're not going to be interchangeable. We expect our first shipment or allotment is going to be from Pfizer and Moderna, and the health systems across the state, including Hartford Healthcare, has put a number of processes in place. Eric and his team, Dr. Troy and his team, put a number of processes in place to ensure that the appropriate people, the appropriate vaccine are distributed and administered appropriately. So 2 primary, Pfizer, Moderna, they're not going to be interchangeable, as in I'm assuming your question is dosage 1 versus the end dosage 2. They're not going to be interchangeable.
Hi, good morning. Bridget from the Republican American. There was some information released, I think, at the federal level within the past 24 hours about how long it would take for so-called herd immunity. I mean, in other words, how long would it take to get these vaccines to all the people that can or will get it? And that might be a year.
I think that's a reasonable number, but a lot of this has. So let's say tomorrow morning we get 1 million vaccine at Hartford Healthcare. There's still data that shows that a number of people are still not comfortable with getting the vaccine, and that's just one of the reasons why we will put a lot of effort into simplifying these documents as much as possible and providing information to the general public. Because one of the things that whenever I had to have this discussion with someone is ensuring that you're informed and you're informing people. If you feel you're informed, inform people about the efficacy of this and how much, we do believe this will help from a science perspective. So that's one piece of it. From a distribution perspective, there's a lot of people in this country. There's a lot of people that are at risk, and it'll take a good time for us to reach everyone. But again, identifying everyone, if we identify a community within the healthcare system, let's say, and we said, let's say, 1 million critical care nurses need to get the vaccine, but from that million, let's say 40% wants to get it at the first go around. It really hinders on the actual progress itself. So there's many elements and factors to be considered. But I think if you think about the grand scheme of what we're hoping to achieve, a year or 12 months, I don't think that's an unreasonable time frame.
Thank you.
All right. If there's no more questions, be safe, have a great day, and enjoy your holiday.